Madam President, I come to the floor today, having been listening to my colleagues, and we see the recent job data, and it shows the effects of our struggling economy. Unemployment is going up, wages are going down, concerns all around the country about jobs, the economy, the debt, the spending. And I have to tell you, I certainly believe, as somebody who's practiced medicine for 25 years in Wyoming, taking care of families all around the cowboy state, and been very involved in the debate over the health care law, that the president's health care law makes matters worse. Absolutely makes matters worse. Worse by forcing employers to either offer government-approved health insurance or to pay higher expenses. You know, each day it becomes obvious to me, Madam President, that the new health care law is designed to ultimately end employer-provided coverage altogether, and also to encourage Americans to join government-run exchanges. And that's why, as a doctor, I come to the floor week after week with a doctor's second opinion about the health care law. Because under this law, businesses are permitted to drop out of paying for employer-provided coverage as long as they pay a fine, and the fine is about $2,000 per employee. Now, this number is far smaller than what it would actually cost the business to provide family health benefits to each of their employees. So what happens with small businesses in this country? Well, they are going to face an ever clearer incentive to drop coverage for the people that they employ. Now, they're not required to pay this fine for the first 50 workers who lose coverage. And then the question is, where are these people supposed to go? Where do they go for their insurance? How does it work? The president promised them if they like what they have, they can keep it. Yet the incentives built into the health care law seem to be encouraging employers to drop their employees. So where do they go? Well, the new health care law has set up what are called exchanges, health care exchanges for these people to enter. Whether they want to or not, they're going to be forced to go that way. These exchanges are shorthand for insurance markets where as much as 80% of the cost of the family's insurance could be actually borne by taxpayers. Under these circumstances, the natural response is for businesses to drop coverage for their employees altogether and then simply offer them, some less expensive cash benefits. Meanwhile, what happens to the employees who are going to lose the coverage that they may like and have to try to replace it? That's what's going to happen. They're going to have to try to replace it with a plan that Washington mandates. And that's a concern to a lot of Americans. This may be very bad news for the patient and is really bad news for taxpayers. Experts predict that the annual cost to provide government insurance subsidies could cost up to 9 times more than what the White House originally claimed. Now, if that isn't proof enough that the health care law is the wrong prescription to help America's job creators continue offering coverage to their workers, let's take a look at some of the things that have just come out in the last week. Just this past week, Monday, July 25th, National Federation of Independent Businesses, that's a group that represents small businesses all around the country, well, they released an astonishing new report. The NFIB has surveyed 750 small businesses. Now, these are small businesses, less than 50 employees. The survey asked these small businesses if they planned to drop health insurance coverage should their employees become eligible for this government subsidy to buy health insurance in the so-called exchange. Well, more than a quarter of the small businesses who offer coverage today, over a quarter of the small businesses that offer coverage today, said that they were very likely to drop coverage, very likely to drop coverage. Another 31% said they're somewhat likely to drop coverage. They need to look into it and find the specifics. But when you take a look and add the ones who are very likely and somewhat likely to drop coverage, you're looking at over half of the small businesses in this country considering dropping insurance coverage, effectively dumping their employees into the government-run exchange. Well, the small businesses group and the survey and the response from these small businesses, it prompted the Wall Street Journal to print an editorial highlighting this data, and it's titled "The Flight to the Exchanges." And I read this and say, gee, I couldn't have said it better myself. The president's health care law wraps businesses in reams of bureaucratic red tape and uncertainty. And adding insult to injury, on Monday, July 11th of this year, the Department of Health and Human Services released yet another proposed regulation mandated by the health care law. The Obama administration issued it's called the Insurance Exchange Regulation. So what the rules do is they give the states the specific framework that they must use to set up a program or an exchange with this Washington-approved and mandated insurance. So here we go again. Another example of where this administration takes roughly 30 pages of the health care law and then turns it into 340 pages of bureaucratic Washington rules and regulations. Now, of course, the Secretary of Health and Human Services is trying to sell this new rule as offering competition and uses the word flexibility, but nothing could be further from the truth. How flexible can a 347-page Washington rule be when it's a rule that contains the word must 580 times? And it includes the word require 811 times. How flexible can that Washington rule actually be? Well, after examining all the rules, musts and requires, one thing is very clear. This administration is paying lip service to state flexibility, while their policy is promoting a Washington-mandated, Washington-dictated, Washington-enforced approach. This regulation details a very complex and confusing process that states are going to have to follow. The states have to follow these confusing rules in an effort to prove to the Department of Health and Human Service that they meet its Washington mandates to set up and to run the insurance exchanges. And you know, they have very little time to do it. So this administration creates onerous new mandates, and then it fails to give states ample time to meet their overwhelming set of requirements. So let's put this into context for the states. Comments of the administration proposed rules are due this September 28th. Typically, it can take the Department of Health and Human Service 6 months to review those comments about the rules and issue a final rule. That means it would likely see a final rule in March of 2012. Now remember, there are significant details missing from these exchange regulations. This regulation is only part of the details that states need to review before they can decide whether or not to run a health insurance exchange on their own or let the federal government do it. So the administration still has yet to release rules explaining the health care law's essential health benefits package, the individual eligibility to participate in the exchanges, still waiting for the rules on quality standards for the exchanges, and waiting for a release of the rules explaining quality standards for the participating insurance plans. Those details may not come out until October or November of this year. This means that states still do not know what the minimum set of health service individuals and small businesses and insurances will have to offer in the exchange. Pending missing details and further rules expected to come from the administration this fall, final rules may be in place finally in May or June of 2012. States would then have to be prepared to submit their plan June of 2012 to Health and Human Services to be certified. So what happens if the rules aren't out by then? You know, many state legislatures end their sessions by June. So making it very difficult for them to comply with these tight timelines, it's almost impossible. Seems to me that this administration will have had 2 years to post their final regulations, while the states may have only 2 months to comply. What happens if a state isn't ready? Well, they say, have no fear, Washington is there to help. That's what they say. If the Department of Health and Human Services, they say that a state's insurance exchange, if it's not in compliance, then Washington will swoop in and set up its own program. This is often called the federal fallback or the federally facilitated exchange. Big fancy words for Washington bureaucrats telling states what they have to do. The irony of all of this, Madam President, is that the administration's rules offer very few details explaining what this federal fallback exchange will look like. So the states don't even know what happens if the federal fallback comes into place. Is the Department of Health and Human Services creating a stealth backdoor federal exchange? So if a state doesn't have adequate time to meet all of the operational program requirements and the burdensome review process, well, sounds like then the Obama administration will take control of the states. So why should a state like Utah, for example, that has created a specially designed insurance marketplace, be forced to comply with onerous and costly requirements of this rule? And if they're not willing to comply, they will face the consequences that Washington will make the final decisions. States should be encouraged to create innovative solutions that meet the unique needs of their constituents, not forced to follow a one-size-fits-all laundry list of Washington mandates. And that's why, Madam President, I return to the floor today as a physician who's practiced medicine for a long time, with a doctor's second opinion, to tell you that I believe this health care law is one that is bad for patients, it's bad for providers, the nurses and the doctors who take care of those patients, and it's bad for taxpayers. And that's why I believe it's important that we repeal and replace this health care law. Thank you very much, Madam President. I yield the floor.